she'll have to say it. I'm sorry, I took my script down for you. But what I
But
loved
definitely,
about Dr. Keesha was that she's a sexologist and she works with hormones, she works with cancer patients, and she really works on complex issues where you're healing the body from the inside out. So, Dr. Keesha, welcome.
Thank you. The internet's really
Can you hear
spotty,
me or
so
no?
you keep going in and
oh
out. So
gosh.
I'm
Okay.
sorry.
Well, we'll let you talk for a lot and we'll just ask you questions. How did you get started in your practice and how did you migrate over to really bringing this in this fashion to, to the people that you work with now? I mean, being a doctor can kind of, have its, I guess, fashion, like existing existing medical science. And so you've really learned to bridge that with how you work today. Can you tell us a little bit more about that?
yeah, so
You bet.
can you hear me? Uh-oh.
We
We
can.
can.
You're perfect. I don't know why
Okay.
ours is spotty, but
Okay. Yeah, so I started off as a registered nurse at the age of 19, and I went straight into intensive care and kind of high adrenaline junkie medicine. I got married, had 4 kids, ran marathons, was a skydiver in that period of like 10 years. And then I got rheumatoid arthritis when I was 30. And it just was an overnight, which is the way my patients say it too. Like all of a sudden I'm sick, when that's not accurate. It takes a lot of years to get an autoimmune disease really built up. And so I got in to see a doctor, and she asked me if I had a family history of autoimmune disease. I said, yeah, my grandfather had rheumatoid arthritis. She said, that's what you have. And she tore off 2 prescriptions off her pad. One was for methotrexate and another was for a non-steroidal anti-inflammatory drug. And she said, when you get worse, come back, we'll change your meds. Not if, but when. And I remember saying, well, hang on, I'm really disciplined. I make my own food. Is there anything else I can do? And she just said, nope, this is genetic. And so on my way home, I remember thinking, I don't think I'm limited to my genetics. And remember, I'm 59 right now. So this was a lot of years ago, before this was well known that we're not limited to our genetics. So I remember thinking my model of medicine doesn't have any answers for me. I wonder if there's another model that does. And so I went looking at the research and discovered yoga for the first time, went to my first yoga class the next day. And in that yoga class, the teacher, he said just enough about Ayurvedic medicine, which is the 10,000-year-old sister science of yoga, that I was interested. And I went home and I looked it up on my dial-up modem and discovered that 10,000 years ago, these, what they're called, the rishis, these sages or learned masters of healing, in their observations of humans in the environment that they lived in and with each other, they actually realized that we're not all the same, and that we're not supposed to feed and water and take ourselves for walks in the same way, and we don't process information the same. And in fact, what they said was autoimmune disease is undigested anger. And I remember really being so shocked by that, because I thought, oh my gosh, but I'm not an angry person. How do I have this? And really realizing that then the next thought, that was probably a core issue, that I put my running shoes on and went for long, long, long miles to run and blow off steam, but I wasn't really digesting any of the things in my life. I was just blowing off steam. And so I really just took that seriously. I started learning how to meditate. And one day in this meditation, I was going backwards with the word autoimmunity, realizing that I was attacking myself
Mm-hmm.
and really committing suicide in a way in a societally acceptable manner. And I thought, is there a time in my life that I actually wanted to die? And so I started with that curiosity going backwards, and I found this little 10-year-old girl version of myself who was being sexually abused by the vice principal of my elementary school. And I remember like looking at her in my meditation and going, oh, she wanted off the planet. I'll bet that this has something to do with my genetics forming in rheumatoid arthritis, right? Taking shape in this disease process, and that they're related. And, you know, and again, in those days, there wasn't any science to back that up. But I went and I started doing some pretty intense trauma therapy. And within 6 months, my RA was gone and it's never been back.
Wow.
And I never did have to take those medications. And so I started going back to school at that point with, okay, this is really compelling. You know, I really liked ICU and I liked hospice because these two models within Western medicine were very complete. You know, like we thought of spiritual care, we thought of the whole family, the dynamic of the environment in those models. And I thought there needs to be a way of pulling it into daily life from the very beginning. And so I went back and I got my family nurse practitioner. And then I got a master's in Ayurvedic medicine and got board certified in functional medicine. And then when I was in private practice, I started having all these people come in wanting hormones. And they would say things like, you know, I did a TED talk about this called, Have You Heard from Your Libido Lately? And I tell this story, you know, like women coming in and saying, my sister, mother, daughter, friend was on bioidentical hormones and they look fabulous. And you gave that to them. I want some of what they're having, you know, and then as I would start asking them really simple questions, like, well, why do you think you need to be on hormones? And you know, it'd be things like, well, my libido is gone, you know, it's non-existent, and I feel really bad for my partner. And then I would say, well, do you like your partner? Often I would get tears. Like people would cry as they're telling me, well, I mean, he had an affair 5 years ago and I've forgiven him, but I haven't ever wanted to have sex with him again. Or he got a promotion and now I don't ever see him, or I lost my job, or I had a baby, or I had my children left home, or, you know, like you name it.
Right.
And I would always say, you know, well, you know, hormones aren't going to help that, you know, or I'd ask a question like, have you ever had libido that you're satisfied with? And again, tears. No, you know, and so I would say hormones aren't going to fix that, right? And so it really, I went into the medical research again looking for answers and there was nothing. And so I conducted my own study called the Healing Unresolved Trauma Study in 2013. And I discovered that, you know, like there are two different kinds of low libido. One's acquired, like you like your partner, you've got a great sex life, and then something happens, right? And now you don't. But then we also have what's called innate low libido, where maybe you have an anxiety disorder or obsessive compulsive disorder, or you've had trauma in your background, and everybody's had trauma in their background, that it's affected your, what I call your libido map. And so I really was able to come up with a model that explained and cured all of that, right? And so that's how I got on the trail that I'm on. Long answer to a very short question, but it's,
Wow.
you know, we all
No,
have
I
a
love
story
it.
that brings us here, right?
Yeah. Is there a way to digest anger? Like,
Yeah, it's important. You have to, and it's different for everybody. So just like we eat an apple and we take the nutrients from it, and then we get rid of in the toilet what we don't want, you know, we don't need. We're supposed to do that with all of our life experiences,
Wow.
oh,
all of
cool.
them. We digest all of them, right? We take the wisdom, the nutrients from it, and then we get rid of all the victim story, right?
Yeah.
That stuff we're not supposed to be emotionally constipated with. We're not supposed to carry it around with us.
Yeah. So
Yeah.
it's really the art of letting go.
letting go, but not just that, right? We also want to take what the wisdom teachings from that. Yeah, it's not just letting go.
Gotcha.
Yeah.
Gotcha.
So
What
sometimes people
is,
will get very like, I call it the tyranny of positive thinking, right? Like, I'm only allowed
yes.
to feel happy. I'm
Yeah.
only
Yeah.
allowed to,
And that's not it either. No.
yeah,
Yeah.
right. That's like what's
Yeah.
called in tantric Buddhist literature a near enemy to truth. It's like close to an accuracy, but then what it does is it disempowers us for the actual human emotions that have to come with, oh, I feel really sad about this, right? And instead of saying you're not allowed to be sad, that's a negative emotion, right? And so we digest all of this in a way that allows us to go step by step by step, just like that apple goes through many different steps before in the large intestine we absorb those nutrients, right?
Yeah, I'm educated as a nutritionist, and I remember like as soon as a food touches your mouth, it starts to, there's enzymes that start to break things down as soon as it touches your mouth. Like it doesn't have to go any
Actually,
any
Ayurvedic
much past
medicine
the
goes further
saliva,
with
right?
this. And it says as soon as you think about it,
Think. I knew it.
Okay.
I knew
right?
it,
You
right?
can think of a juicy
Like
red
a
strawberry
pickle.
right now, or
Right.
a lemon being sliced in half. It's
Yes.
nowhere
Yes.
near us. We can't see it,
Uh-huh.
touch it, feel it.
Uh-huh.
But I've got saliva going right
Yeah,
now,
yeah. Yep.
I love that.
Yeah.
That's so
Wow.
awesome.
which is
And
exactly what happens
I knew
with
you were gonna, yes.
our memories and our thoughts, right? You
I
can
knew
be
you were gonna
sitting
say that.
there sipping a cup of tea, looking at the hummingbird at your feeder, and you're having this peaceful moment. And then all of a sudden, you bring in some ruminating thought loop about something that was stressful. And guess what happens? Off you go. Your cortisol released, right? You're stressed. Why did that person say this? How come this happened to me? Why didn't I do this? And and all of a sudden everything's destroyed in front of you, and your body's in a stress response. Yeah.
What would you tell someone that I mean, I kind of do that naturally, and I've, done this work, but there are some times where, I don't know if it's just something that like I picked up as a coping mechanism as a child or something like that, where I will, run loops of like maybe a conversation and, oh, maybe they took it the wrong way, or, really like almost losing sight of myself. I've learned to really kind of work with that a lot, but I mean, what would you tell somebody that has that going on and that may not even notice? Is that something that when they come to you, it's already developing in the body most of the time?
Well, everybody has that.
Yeah.
Everybody.
Okay. Okay.
It's called the default mode network of the brain. And when you're not actively
Thank you.
creating a conversation with somebody or coming up with a solution to a problem or engaged in something else, right? As you rest your mind, it goes into default mode network. And it's a series of parts of the brain that go on thought loops. And guess what the center of the loop is? Me, my, I, right? Myself, myself, myself. And it's very narcissistic, this thing, right? And it's okay. Like that's the way it's organized, right? One of the things I love doing is work when I help people start what you just asked me, Jenna, like how do people digest, right? Their anger, their trauma, their memories, their experiences, is to get them in touch with what's the theme, the flavor, the fragrance of those automatic negative thoughts, those loops, right? The default mode network gets into. It's actually what the research shows, that things like in the proper set and setting with the proper facilitation, psilocybin interrupts default mode network looping, right? LSD can interrupt default mode networking. And so what you get to do is it slows that down. In Buddhist thought, there's this, like their philosophy. I love this. They've studied the mind so long and so detailed, right? That for every perception you have, like if you see my shirt and you go, oh, that's the color of pickled beets. That's actually the name of the shirt color. Or purple or whatever, right?
Yeah.
You go, there's 17 steps you went through to
Wow.
actually name that color, right? And it's for everything. Every one of the senses that's bringing you information, you're going through 17 different steps at a time to perceive. And so halfway through those 17 steps, they call it the gateway to karma, doorway to karma. You have this moment to create a gap. I think about it like an elevator door, when you're rushing up to the elevator door or the train in the airport and you put your arm in there and you can open it back up.
Yeah.
That's this moment. This is the answer, Jenna, to how do you start doing this, right? And so when I facilitate people, when I'm helping them heal trauma, it's not with talk therapy. That doesn't work. You don't
Yeah.
want to just be operating from your prefrontal cortex like you would just be chatting with your friend, right? That's not going to do any good.
Mm-mm.
You want to open that gap a bit and be able to stand and turn around 360 degrees and see yourself, your own mind, observe how you're perceiving. Because one of the things they say, and it's so accurate because you can see it for yourself, is that how you have perceived that thing is how you've always perceived and how you will
Mm-hmm.
always into the future perceive. And if you want to shift it and really digest and heal, right? Like you're trained as a nutritionist, stomach acid's important, digestive enzymes are important. This is like one of those things, right? Is being able to go in and just look around at how you are thinking about yourself and the world and everyone else. And then you can shift it. If you can create a big enough gap, you can go, oh, I call this curious, compassionate self-confrontation. It's
I
in my
love that.
healing resolve trauma study. Like the willingness,
Mm-hmm.
looking at the way your mind works, not what everyone else has done in the past, future, present tense, right? But you and only you. We don't worry about
Nice.
everybody else. We just stay right here. There's enough material right here,
Yeah.
right? And you just like go, oh, I see, right? I see that I feel unsafe all the time. And yes, there's a reason for it. My small child self had this trauma thing. Oh, now I'm looking for similar patterning. I will find it.
Mm-hmm.
And then I behave from that. I have meanings I attach to certain things that occur. And this is mine because actually, this trauma that I've been through is long past, right? And I'm never going to let that happen again to my little child self, right? And so this is it, right? This is the place where we get to have wisdom.
Mm-hmm.
Wisdom. We get out of
Mm-hmm.
shame, blame, fault. We go into wisdom attainment.
Yeah, that's beautiful. Uh,
Yeah.
I love that as curiosity.
Mm-hmm.
Most of my work it's like inquiring or questing or starting with the question, right? So
Right.
I really feel like that is the door that opens all doors. Is
Mm-hmm.
question always responds, right?
I always say willingness is the first step, right? When you say, like, how do people digest? It's like willingness first to have that
Yeah.
curiosity to compassionately self confront.
I
Like,
like the
gosh,
compassionately.
and there's a moment because I remember having it for myself, like, oh, I was nursing my third child. It took me 3 children to figure this out, by the way. I was nursing my child in the middle of the night. She was just so beautiful, and the moonlight was hitting her face. And I was sitting there going, man, if presidents and kings could have this experience, they would never send children into war, right? And I just remember having this thought process at like 1 o'clock in the morning, sleep deprived, looking at this beautiful, innocent child, and then like filled with overwhelming love for her, and then thinking, "Oh, my mom probably felt this at some point for me.
Yeah.
What happened that I've lost sight of that, right?"
Oh, wow.
And then I realized in that moment that some of the different things that our energy systems that are not alike, right? That had happened, we'd frozen each other in this place, right? Of our perceptual field. And here I am, like 29 years old, just realizing this. And I thought, oh, whenever I'm upset, I'm present. Hmm. maybe it isn't all of those people out there or my experiences from the past or any of that stuff. Because I was asking the question, like, how do I make sure that my daughter and I have a really beautiful, like, that I never lose sight of this, right? And that she can feel it from me for the rest of her life. And then I remember thinking, oh, yeah. Every time I'm upset, it's because an expectation of mine hasn't been met, and it's
Yes.
that moment. And that's what, if people are willing to have that moment where they go, okay, this might have something to do with the way I think and perceive, then, right, that curiosity can arise, bringing compassion to it. Then you can start really questioning and looking at that.
Yeah. You said that autoimmune disease was directly related to digesting anger.
Yeah.
What about other things like, you
Cancer
know,
too.
most of it is not digesting some emotion?
Yeah.
Yeah.
Yeah. Undigested. Yeah. So I reversed my rheumatoid arthritis. I never say I cured it because it's in my genetics. If I were to go back to the way that I was, when I was 30, I could get it back again really easily, I'm quite sure. But then 10 years later, my son in college came back for a break and was sitting at the dining room table, and he said, Mom, I have to tell you something. And I remember going, uh-oh. And I sat down with him and he said, back, when he was just a little tyke, like I think 5 years old, he and his older brother had been sexually molested by our neighbor boy who was 12
Oh,
at
I'm
the time.
so. Mm-hmm.
And I just remember like freaking out hearing this, just of all the things, this was the thing, right? That on my watch, I had allowed this to happen. And so I went into, crisis intervention mode. I found the young man, I called him up, and he said, I've been waiting for this call for 15 years, Mrs. Ewers. And
Wow.
it was this really interesting. I didn't scream at him or anything, I just said, I have some questions for you. It was just like this really amazing process. I facilitated a forgiveness process. I had him pay for part of their therapy. Like, it was this months of really remarkable, beautiful processing, digesting, right? And the kids were great. And and then 4 months after that, I was diagnosed with breast cancer, a tumor over my
Interesting.
left, yeah, over my heart in my
Of
left.
your heart. Yes.
And I remember seeing it on the ultrasound monitor, like this really strong blood supply to it, right? And I was like, I know what that's from. And I realized just in the split moment that I saw it living in there, like pulsating with life, that was me leaving me out of the process. That I had
Interesting.
so much self-loathing for the younger version of myself that had allowed that to happen to her children. And I could not forgive myself. And so I knew what I had to do. I said, give me some time. I know what I have to do. And I went deep again into some heavy trauma therapy. And it was the hardest. Like, it was so easy for me to forgive my perpetrator compared to forgiving myself. And oh my gosh, I just couldn't do it. I could not do it. And then I realized that I would be depriving my kids early and grandchildren of a grandmother, like, why was I making this about me? And it was like this really important moment of, okay, this younger version of yourself, you're abusing her right now because she didn't know that this was going to happen, right? She didn't know. And
Right.
so, like, you're being abusive and literally killing her.
Gosh.
And so I got it and just wept and wept and wept. And it was really interesting because the therapist that was helping me in the moment was hypnotherapy. When I opened my eyes, when I got that moment, she was crying. And she said, I wish my mother had given half of a shit of how deeply you feel for this, And it was like she was healing something, right? And I went back a few weeks later to have another follow-up ultrasound, and it was gone. It was
No.
gone. And I don't run around telling people that that's like, I don't think anybody ever has a disease process in their body for one reason, or that there's one thing that did it. Don't. And I don't believe it's one thing that's going to transform it, and that there's one way to do it. There's not. This is my story, and this is what happened with me. And I really understood it when I saw it. Like, that right there is self-hatred, like conquest, right?
Yeah.
I know what I have to do. And so it was really amazing, that digestion of self-loathing.
Wow.
I mean, it was anger in a new flavor, right? Yeah.
Yeah.
That is, you brought me to tears because you are a doctor, and this was a long time ago before, we had the convenience of the internet, so that we, could have a group or talk about this stuff on a podcast or anything like that. So it's you searching for answers and being very brave to investigate this so that you could share this today, right? Like, I just got this image of you doing all of these things so that way you could share this information and help others heal. What a amazing, I'm just giving you all these accolades, like what amazing gift this is to us all. But I can imagine like what kind of bravery you had to have to even research this as a doctor, but then again, turn around and look at yourself with these
And
questions.
then energetically change it for yourselves. I mean, because a
And then
lot
know
of
that you
it's
could.
just a lot of heady stuff, right?
Well, you have to remember, I started out as a nurse, and I'm not a medical doctor. I'm a
Yeah.
PhD, which means it
Yes,
comes with
that's true.
curiosity.
That is true.
Right?
That is true. That is true. Yes, yes,
Yeah.
yes.
Okay.
But you
It
still are
comes
in
with
the
a ton of curiosity. It's like,
Yes,
yeah,
absolutely.
research. It's a
Yes, yes,
research-based
I love
degree. That's
research.
my
Yep.
doctorate, right?
Yes, yes,
Yeah.
absolutely.
Shall we take some live callers from the,
Sure.
yeah. Okay. And if they just say, here's my question, is that basically all you need? They don't
Yeah.
need the whole story. Okay. All right, Joe, you're up.
Hi, Joe.
Wow, that was quick. Um, Undigested anger. You just described me in my younger years to the point of blind rage.
Mm.
Um, and I knew the blind rage was there with me all the time. And I used to tell people, don't pick at me. Many years ago, I had a guy that when he heard that as a challenge.
Oh.
And to make a long story short, on a job site, I nearly killed him. Didn't even know I did it. That's when I knew something had to happen. And I'm going to give you a little bit different aspect of you talking about how you work with anger. This is something I've created over the years. I started seeing anger as like a secondary emotion. It's a reaction, almost always a reaction to something. As I worked with that more and more, that helped me keep the blind rage down. Oh, I forgot. Um, a lot of people say, "Oh, your blind rage is genetic. There's nothing you can do about it." No, it's ancestral, not genetic. Two
Mm.
different things.
Yeah, for sure.
I was taught that.
Yeah, there's
The
definitely,
way
my daughter and I have a podcast called Liberating Generations, and we talk about this ancestral piece. It's a really important one to know about.
yes, and
Do you have a
what
question,
I
Joe?
did with it, okay, it says I can handle that. Or for me, and this is just for me. People don't respond to it too much, but it works for me. I don't even look at anger as an emotion anymore. It's golden trigger. When
Joe,
I
do you have a
become angry,
specific
I stop.
question for her? Because we're kind of just taking
I'm
questions right now.
getting to that. I'm
Okay.
getting to that. That's how I work with anger. I stop right there. I want your input, asking for what you think of that method.
I look at anger, and I love what you just said, because I look at it as a hard crust that's hiding something softer, which is hurt, sadness, pain. Anger has a fire with it that allows you to actually take action, that reaction that you were just talking about, right? So questioning the action that's being called from the anger is a fantastic method. And then I would actually encourage you to look underneath it for the hurt. It's so much easier to feel anger than it is to feel hurt. Yeah. Thank you, Joe.
That's so beautiful. I guess sometimes we don't dissect anger. We're just like, I'm so angry. And then it's like you don't really like go any deeper than that necessarily. Because you're just like,
Well,
I
it
just
calls in
expressed
your
it.
protector that you designed for yourself, and you might have more than one when you're a small child who is protecting your innocent psyche to push away whatever is hurting you, right? And
Mhm.
the importance of willingness to self-confront is to say, so what's that protector protecting? Right?
Mhm.
Is there's like a part in there that doesn't want to be seen by you, and it doesn't want to be seen by anyone else. It might be protecting like someone that is afraid of feeling stupid or inept or unlovable or unworthy or any of those things, right? That's the one where if you can allow that protector to step aside, call that one forward, right? And then have compassionate connection with that one and say, oh, you're loved too. All of this is welcome.
Mm.
Then there's less of that need to control, suppress, oppress, repress, right?
That's beautiful. Wow. All right, Christine, you're up.
Christina, I think you're muted. There you go.
Christina,
Yeah,
yes. There you go.
sorry. Yeah. Hi there,
Hi there.
lady. I got a question. Due to the experiences I have with men since I was a child, different ones, and throughout I was growing up, I don't really have. Well, I didn't have, trust in men. I don't really know. So a couple of years ago, a healer told me that you need to, just change your outlook on men, and generally, you just need to change it. I'm thinking, okay, so how do you do that then? I mean, is everything, sexually, everything, with them, because I just don't have the trust in both of the areas. Yeah. So I'm just wondering, when you're over 50, how do you do that then suddenly? It's like,
Well,
yeah,
are you complete with your question, Christina?
yeah,
Before I hop in? Okay. So you don't suddenly do that. That's for darn sure, right? Just like you can't suddenly digest an apple. It takes time,
yeah,
right? You want to have spaciousness,
yeah,
lots of connected, compassionate awareness around what's happening. And so whenever you say, I don't trust X, so in your case, you said men, right?
yeah,
That right there is a beginning, right? Because are all men the same? Are all women the same? Are all
yeah,
non-binary people the same? This is just not a thing. Everyone has separate fingerprints. That's how we can be identified in the world, is our separate fingerprints. And so there are no two men that are the same. There are no two women that are the same, no two non-binary beings that are the same. And so it's taking that very black and white statement, and you can hear it in your words when you speak, is everyone that's listening to my voice. I'm not just talking to Christina. If you have some sort of speech that's going through your mind in that default mode network when you start ruminating, that has something to do with a black and white declarative statement, like, I don't trust men. And then to have somebody say, well, you need to learn to trust men. Of course, you're going to have some resistance in there, right? It's like, oh, hell no. And so who is it that's resisting in there is the one that's been hurt multiple times by individual beings, not men, but unskillful beings who had a dysfunctional way of grabbing power or whatever their need was in the moment that they were enacting with you. So we have power dynamics that are at play when we get hurt. There's a power over and a power under dynamic. Power over is the one that, you know, my needs are more important than yours. I'm going to unilaterally make a decision about it. I believe that I can meet my needs at the expense of yours. I don't have to think about another person. Power under will usually meet power over in life. Okay, this is where the narcissist empath thing comes in. So the power under mode is, yeah, your needs are more important than mine. Yeah, I'm going to go ahead and make sure that happens for you. Yeah, you know, and then I'm going to be really bitter and resentful about it later. So the power alignment is the skill that you have to learn, right? To be able to recognize another person's need and your need, toggling back and forth simultaneously with equal respect, that both of those needs can be met, and willing to negotiate for that. A no means somebody just set a boundary and said, no, I can't do that. But it doesn't mean you've just been rejected. It means now a negotiation has started. Well, how about this, right? It's willing to stay at the table and say, your needs are important, and you get to say no. My needs are important, and I get to say no. Let's find a yes together. Okay. That's a skill. And children don't have that skill. They don't have the ability for complex thinking. It's very black and white. You're either bad or you're good. You're doing it right or wrong, right? And so when you find yourself in a black and white frame of reference and you're saying, I don't trust men, it means your child self is present. And your child self cannot learn how to undo that. It's your adult self that needs to. And you need to go to your child self and say, you don't have to do this. This isn't your job. I've got this. And right now I'm not very skillful at it. So I'm going to go learn some new skills. And that isn't going to happen all of a sudden. That happens with one thought at a time practice of the new skill. Just like starting piano lessons. It sounds pretty ugly at first until you get through the clunky parts, right? Yeah.
Oh, that was well said. Wow.
Yeah, really well said.
Oh my gosh, that was so great. Just like this under and this over. It's in my work, I usually, like, if somebody comes with like a definitive point of view like that, like, here's this conclusion and it's this way, it's so interesting to look at, okay, well, when did this start, right? But I kind of like your method a little better. And I just feel like I've got so many questions for you. I'm going to change the topic.
Well, people can, for Christina, you can take nonviolent communication class. It's a great way of learning that, right? About needs and feelings you have when your needs aren't met. And you might have anxiety if a need for safety doesn't feel like it's being met. But my encouraging, moment right here for you is to recognize that you may feel unsafe a lot and it may not be super accurate. And so you get to then go to your little one, take her by the hand, put her behind you. She doesn't have to lead anymore in life, right? It's not her job. Now you can take the helm, right?
I've been saying that actually, to be honest, I've done all that, I'm on that road trip, kind of thing, so,
Good.
but yeah, I just thought, how do you do, because you learn to interact with men in a way that wasn't, whatever, and then I'm thinking, yeah, it's like, so I keep saying that to the inner child, you're not, whatever, but still I find it like, to interact and learn, like not all men are like certain ways or whatever, and how to realize that in a nice way and feel comfortable with it, and not feel stressed about the trust issue or the sexual issue or whatever. Yeah, so
Well,
it's
remember, Christina, and I'm going to say this to everybody. I often say this when I'm doing retreats. I'll look around the room and I'll say, are you 100% trustworthy? Have you ever hurt another person? The answer is no, you're not 100% trustworthy. You might have woken up this morning and said, I'm not going to eat sugar anymore. And by 2 o'clock in the afternoon, you were eating sugar. And so that makes you a blatant liar and completely untrustworthy, right? And so your child self is like, I can't trust you, right? I can't trust
yeah,
you.
the
It's
sweet
not the
one.
men I'm worried about. It's you. And so you get to establish that trust with your little ones. Like, okay, integrity, super important. Because remember, if we don't trust others, it's because we're not trustworthy.
Yeah.
So you get to
Wow.
play with that. I always bring a lot of laughter
That's
to it,
good.
because the other thing is, like, we always want everyone to make us feel safe, but how are
Yeah.
we safe
Yes.
for everybody else? Absolutely not, right? I'm always
Definitely not when
rocking
it comes.
people's world views. I'm very unsafe to people,
Yeah,
and
when
so,
it comes to chocolate, definitely, I would say I'm not going to have so much, and then suddenly I have a whole packet.
exactly. Yeah.
So
Yeah.
that's
So,
true.
so, so have some humor around it, right? It's
I
not
always
always
have humor,
so,
but
yeah, exactly.
well, thank you.
Dr.
You're
Keesha,
welcome.
you had suggested a class that maybe she might look into. Can you repeat that again?
Nonviolent communication.
Oh, that's great. You
Yeah.
also mentioned, and I think we probably need to move on, but you also mentioned you called them, you said maybe unskilled beings, that it wasn't all men, but or anything, right? You very pinpoint said, I think it was unskilled beings, and so then when you can see each maybe, I don't know, perpetrator, violator, whatever those things are, anything, even my own self, right? Sometimes I'm
Not
an
even,
unskilled being,
especially.
right? Yes,
You have to say, especially me.
especially me. Thank you. I
Especially
think that's
me.
great. Can you repeat that again too? Because I thought that was actually super phenomenal.
Yeah, anytime there's drama, you can look at, like, the drama triangle, right? There's going to be a rescuer, there's going to be a perpetrator, there's going to be a victim. Whenever there's drama, and you're going to be cycling between those roles again and again and again, around and around and around
Yeah.
in a given conversation, right? You'll be perpetrator, you'll be victim, you'll be rescuer, and it's all to meet some need. It's just unskillful. And so anytime there's drama, there's not skill. So you can go, oh, I'm finding that I'm unhappy a lot. I'm triggered a lot. I'm reactive a lot. I'm running around with drama around me. And so I know that there's some skill that I can learn here, right? I need a new
Yeah.
skill, and I'm going to go learn it, and I'm going
I
to
love
commit to it.
that.
And I'm going to tell my child parts, right? I've got this. I'm going to go learn how to do this better, right?
Because it
And then
gives
you
you,
can take on the durable triangle, which is to be a good resource for people, which is what we're doing right now, to persevere. We're not attached to an outcome. We might give somebody a resource and then they don't take it, and that's okay. That's their choice, right? How often have you ignored resources that were offered to you, right? And then being vulnerable, like sharing a story with somebody, but then not being attached to how they take it. In other words, people get to hate you.
Yep.
People get to be disappointed in you.
yeah.
Because if you look around, you'll realize you don't always like everyone, and people disappoint you too. So why do
Yeah.
you arrogantly suppose that the opposite is supposed to be untrue.
Absolutely.
It's
Why
a
would
real form of
everybody love
arrogance,
you?
right?
Right. Thank you. And thank you for
Oh my
bringing humor
gosh.
to that too, right?
Yeah, it makes it very funny when you start looking at it. It's like, oh my God, my control freak is out hardcore right now. I'm trying to manipulate the entire world to like me, to keep me safe, right? Like, okay,
And then I wonder why.
I know. I'm gonna let that go now.
Yes, for sure.
Our
Yeah.
egos are fun sometimes.
Yeah, yeah.
I wanted to talk to you about sexology. And I know very, very little, but what I do know, and from having somebody else on the series at one point, was that you really do get to dive into hormones and dive into, as you spoke at the beginning, libido. And it's just as I've hit perimenopause, I've, really been like things are changing. And I've had intrusive thoughts and things like that. And I know that it's all because of hormones.
Mm.
When we're going through phases like this and we are having these changes, is what role would a sexologist play in supporting those changes?
I think of sexology as the study of relationship dynamics, and it's the relationship between you and your body, you and your story, you and the world and the others that you inhabit it with, right? And so what's in your head goes to your bed. So if you're not sleeping well, if your relationships are crap, if you are having drama, like all these things, sexology is actually the study of all of those things, right? It's bringing curiosity to it. And so anytime that you're running into an imbalance somewhere, you're going to find the answer in your story, body, mind, heart, spirit. So low libido, for example, there's usually not just one of those, right? So there might be a history of some hurt with another being, right? In bed sexually, that's the most vulnerable time that we are in. And so, gosh, some of those, I call it the wounding on the libido map. In whatever human growth and developmental state you were in, when that wounding happened, you're going to have arrested development right there. And there will be some intrusive, automatic negative thoughts that go with that create rumination loops. In your body, you might have a thyroid issue. You might be going into perimenopause. You might have adrenal burnout because you have burned the candle at both ends for so many years, thinking that achievement orientation and productivity model that our culture is based on somehow is going to be forgiving. No, it's not. At some point you have to pay the piper, and burning the candle at both ends burns out your adrenal glands. Then you hijack the pregnenolone that makes progesterone to make cortisol, because the body knows that survival is far more important than reproduction. If a zebra is being chased by a lion and it thinks it's about to be dinner, it knows it's not safe to stop and have sex or to go to the bathroom. So digestion and sexual desire go away in favor of make it to the horizon and safety. Now, when I did my study, I looked at a whole bunch of women's fMRI brain scans. And I thought, why has no one noticed this before? The same parts of the brain that are required for a woman to have sexual desire are the exact same parts of the brain that are hijacked when you're in a stress mode.
Wow.
You cannot have libido and a feeling of overwhelm at the same time. Just like you can't have proper digestion and a feeling of overwhelm at the same time. You cannot stress, eat, and have yourself digest well. And you also will eventually kick over your little hormone, your reproductive hormone buckets in favor of cortisol. And eventually that will show up. Your body does a lot of behind the scenes robbing Peter to pay Paul.
Wow.
Eventually, though, Peter is bankrupt and you'll start to see symptoms. But it's been happening for a lot longer before that.
Wow. I am
Wow.
so enlightened. Thank you.
That was,
Yeah, you're
I've
welcome.
Yeah.
never heard it said that way. It was so beautifully said. My gosh. Well, that makes so much sense. I mean, I know when I've been working and kind of I wouldn't call myself like stressed out, but my head's been in that mode. Then my husband will be like, "Come on, let's go," and I'm like, You know, I really do have to energetically decompress
Yeah.
before, yeah. And I
I'm going
never
to give
put
you
one
all
and two
this really
together.
amazing study I found back in 2011. And
Okay.
I mean, I'm on the rooftops talking about it, but not many other people are, and I don't understand it. 69% of women will no longer have spontaneous sexual desire after being in a committed relationship for a year or more.
Oh, dang.
What?
69%. It is more normal
Okay.
to not have spontaneous desire after you've been in a long-term relationship than it is to have it. So our rom-coms and all of the like images, the myths we have out there that make us feel like we're broken somehow are really creating a problem. So what I always tell women is you do not have to feel desire to have sex with your partner if you have a good, safe relationship. So if you like your partner and you know, okay, intellectually, I know this is good for our relationship. It's also good for my body. I release oxytocin. I have all these yummy things that occur in my body when I do this. Okay. So instead of thinking about my shopping list and my to-do list, I'm going to commit to feeling arousal first. I'll just put myself in the place where I can start feeling arousal, and desire may or may not follow next. Men can't do it that way. They cannot have arousal first and desire second. They'll have desire first because this is the way the Masters and Johnson curve goes, right? It's like, it's so visible. For women, though, it's circular. We can enter into the cycle at any point.
Wow.
So you
Interesting.
cannot
Yeah.
have an orgasm, which is not really necessary for sex. You cannot go to sleep, fall asleep, if you don't surrender your control, if you don't empty everything out of your mind and just let go. But you can still have sex.
Yeah.
So, right?
Yes. Yes. Yes.
Yeah.
And I think that
Wow.
you nailed it when you said like the rom-coms. I mean, I can't tell you how many times I've read, the Dear Abby kind of thing, and it's like, he just doesn't, everyone. I feel like he just doesn't like pin me up against the wall and make me go crazy over him, like that kind of thing. So they immediately start, writing that person off when you're saying like 69% of women in a committed relationship, yeah, you're not getting thrown up against the wall every other day, right? Like in a long term, like maybe you might be,
I might
but
be.
maybe you might be.
Well,
But
the same thing goes for men too, though. Like,
right.
it's underreported how low libido happens for them because it's like, it's in our culture, they're not allowed to not have a sexual thought every minute
Interesting.
because, research says a man has a sexual thought every minute.
Yes.
So then if they're tied up around work stress, relationship sadness or stress, or not feeling good enough in something, then they think they're broken because pinning someone up against the wall, right?
Yeah.
And so it's the same thing in the male body, where if cortisol is being released constantly, testosterone gets stolen. So I send my male patients now for DEXA scans for bone density issues, where that
Interesting.
can only be a female issue. I have so many male-bodied patients nowadays who are estrogen dominant, very testosterone deficient, because cortisol will hide the need for cortisol production will hijack testosterone. So now they're estrogen dominant also because of all the estrogen mimicking and reproducing chemicals in our environment that they're exposed to too.
True.
They have
Yeah.
estrogen receptors in their bodies. And so this is not just a female issue.
Yeah.
So I always tell people when
Wow.
I give talks from stages to doctors, I always say, you know, like really good sex comes from really good communication. Really great sex comes from really great communication. And scrape you off the ceiling sex comes from scrape you off the ceiling communication. Those skills we were just talking about 10 minutes ago, that leads to amazing sex,
Yes.
right?
Yes. Yes.
Yeah.
Yeah. True
Yes.
connection.
Yep.
True being with
The
another.
willingness
Love
to be
it.
vulnerable, persevere, not make up stories, not have your child self, the one that's like filtering everything, right? Yeah.
I have a theory, and I want to know if it matches with any of your education. If you have regular sex or orgasm or climax, or I don't know if you have to have one or the other, but you get those oxytocin levels up on a regular basis, does that help balance your hormones in general?
No,
No, not
but
necessarily.
it does do other things. So I always tell women it's a really good idea to take your vagina to the gym every day. It is a muscle. And so if you don't use it, you lose it. It's the same with men. They'll get erectile dysfunction if they don't use it. And so you have to actually continually use these organs. And for women, female bodies are the only ones that have a body part that is meant only for pleasure. Male bodies don't have that, right? Female bodies have one body part that is designed for one thing only, and that is for pleasure. And this idea that we have to get all our work done before we can have pleasure, this puritanical thought stream, right? And judgment that we have about our worth, we're getting in the way.
Yes.
No one else is, right?
Yes.
To that. Yeah.
Yeah.
And so the answer to your question about orgasms and sex, they're not the same, right? Sexual activity can be foot rubs. Like it doesn't mean intercourse. Sexual activity, you can release all those yummy hormones through touch, through other things, you know? And so intercourse then can lead to an orgasm, but so can other kinds of touch. And so orgasms are not necessary in the equation. I think that's like a finish line thing that a lot of people get hung up on. I have to grab the brass ring or else it wasn't a good encounter. And so then that's again a judge standing there, right?
Yep.
I interviewed somebody from One Taste once, and they were saying, no, you never really have to climax, you know, and they kind of use terminology a little different. So, you know, when they are, you know, touching the clitoris and, you know, and doing activities like that, that is actually what they call orgasm, right? But it's not a climax. So they kind of separate those two and make it different.
Well, they are different. Yeah.
Yes.
You can have three different kinds of, I mean, in the female body, you can have, they're like three places, three different kinds of orgasms. Actually, there are more. And you just want to make sure you don't get hung up on a choregasm. Like this is a chore. I'm trying to make my partner happy because he doesn't or she doesn't feel good unless I have an orgasm. So then you're there to make that happen for them. And it's just a mess. That's where the scrape you off the ceiling communication is so important.
Thanks for going there with us. I just kind of felt like hormones was my thing this year. I'm going to get some information about it. That's fabulous.
Yeah. And testing for hormones, not just blood work. That's like saying what is in your refrigerator is the whole story. If I come and I look in your kitchen and I open your refrigerator and I say, oh, you've got blueberries and salmon and greens in here, you're doing great. And then I walk away, but I don't come back and see that you were so busy you never ate them or cooked them and you threw them away 4 days later, then I did not get an accurate picture of what I did with those things. And so I use dried urine and also blood for looking at hormones. Plus, what does your body do with those hormones in terms of metabolites? Those are what cause cancer. And so I always look, you know, in this very comprehensive way when I'm looking at hormones. It isn't just blood testing. That's very inaccurate and ridiculous. Yeah.
Really? Good to know.
Yep. Thank you.
Yeah. Can you diagnose off the symptoms alone, or is that even
No,
worse?
because estrogen dominance and progesterone deficiency and testosterone deficiency, women a lot of times have very, very overlapping in thyroid problems. And I mean, what's the number one symptom, do you think, for anything?
Fatigue.
Yeah.
Stress.
No, stress isn't a symptom.
Oh, okay.
Yeah, fatigue, right? That's going to be
Yeah.
on everybody's list.
Yeah.
What do you think the second one is?
Anxiety or
Brain fog. That's like the second most reported.
Yeah. So I can't tell
Insomnia.
if I'm pregnant or
Right? You can find those on any kind of
right.
We
'Cause it's
call,
all
yes, we call them secondary diagnoses, where we're looking for what's the comorbidity or what could this be rather than this. You can never go off of symptoms. Never, never, never. If anyone's prescribing for you and not looking at your metabolites every 4 to 5 months, you're at risk. You should never do that.
Great. So if we were to go to you to have you look at these various areas of my life at this time, I'll just use myself as an example. Can you kind of talk about what your process would be, what that would look like?
Sure. Well,
And just
my
put
right hand
yourself out in
woman,
general.
my office manager is named Nikki. I'm going to do a shout out for her. She's been with
Yay.
me for over 15 years. She will have you read the book that's behind me over here, Solving the Autoimmune Puzzle, because it gives you the framework of how I work with people.
Okay.
And so then that's a pre-education, right? Solving the Autoimmune Puzzle is a great place to start. And then she'll listen to your story, and she'll check in with me and recommend the tests that she knows will probably, based on I call it the freedom framework. We look at genetics, we look at adrenals and hormones, we look at gut microbiome, and we look at total toxic burden. Because
Wow.
toxins will upset your estrogen, an upset microbiome will upset your hormones. You like these all, right? And then also trauma. So we look at all of those at the same time. And so then the testing, we wait for that to come back, and then it's a very individualized plan of care. It's never the same through everybody. So we want to look at like I have genetics that are terrible. I got breast cancer already. And it was an emotional traumatic issue that upregulated that gene. But my genetics make it really hard for me to metabolize all of the estrogen mimicking chemicals in the environment. Even though I am pristine with my diet, my environment, I don't use any kind of anything in my home that could possibly be estrogen mimicking, but it's in the air, water, and soil. So even if you eat organic, I juice every single day, vegetables, I still have to take a supplement to help my liver clear out the carcinogenic estrogen metabolite or hydroxyestrogen. And so by taking that supplement, though, I keep it clear. But I never knew any of that until I did the testing.
Sure.
Right? We want to ask your body individually what it needs to feel supported by you. It's a different way of thinking about it.
Yeah, no, that's fabulous.
Yes.
Yeah. Here's this body, right, that you have the blessing of running around in, and it rarely gets any gratitude, let alone acknowledgement that, oh my gosh, you've been supporting me for decades, and I've never really asked you how you need to be supported.
Right.
Right. And so testing for me is as the language of asking the body what it needs to be supported.
That's fabulous.
Yes.
And so Dr. Keesha has given us a free gift for you guys. I'm willing to put that link in and around the rewatch of this, as well as your book, and a link to your website, or where would be the best place for them to go?
Yeah, my website has a apply to work with me button, and you can say that you heard me on this podcast, and Nikki will get back to you right away.
Nice, very nice. Yeah, so you can just let them know that you heard you talking about the way and work to work with you on the Hot Hustle podcast. And then if you did the free gift, tell us a little bit about that. It's, I
So
believe it's
21
21 day weight loss. But tell us a little bit why it's different or how you approach
It's
that.
not actually weight loss. It's called the 21-day quick
I'm
start guide.
Okay.
And it doesn't sound like a gift because it's 21 emails into your inbox. So you kind of have to like whitelist us, but it's this very simple little things that you can do that cover body, mind, heart, spirit, and story. And so I've divided it up and I've given you these little tips, these little hacks that you can do that I started with myself in my journey. And, we know that 21 days makes a habit. And so
Yes.
they're not time consuming, expensive things. They're things that you can implement right away.
Great. And I put the link in the chat as well. But I will add those other links as well, because I feel like everyone should probably read your book.
Yeah,
Does
Thank
everyone
you.
kind of like, even if they're not having symptoms of autoimmune, it seems almost as if everyone does kind of have that going on in their system. Am I wrong with that?
It's 1 in 4 people, and it takes
Really?
20 years to actually develop a full-blown
wow.
autoimmune issue. So a lot of times people that are listening to my voice are developing it and don't know it,
Yeah.
Right.
Yep.
Yeah.
That's what I gathered.
Yeah.
Immediately when you had mentioned your book, I thought, I had never really considered myself having autoimmune, but then I was like, but everything that you were saying seemed like exactly what I needed to know about.
Yeah.
So I think that's why, is because like you said, 1 in 4. Yeah.
Yeah.
And it's the way to prevent it. by doing
Exactly.
this work.
Turn
Yes.
that ship around before it goes into the iceberg.
Yes.
Yes, please.
Yes, I'll
I
have a lot of
know.
that. Yes.
Unfortunately, our Western medical model makes us run into the iceberg. How many of you have heard that? Like, well, let's just keep an eye on this. And if it gets worse, come back. I'm like,
All the time.
I know. Why do we
Yeah.
do that? Yeah.
Oh, absolutely. Any parting words?
Well, yeah, the thing that we've been talking about today, and I just love your show and
Thank
the
you.
ability to take questions or anything is so cool. Is, a lot of times we think that we have to passively watch what our mind is thinking. And yet, if we're on the internet or we're watching a show and we don't like it, we get the little clicker out,
Yeah.
And so it's important that you recognize that you actually need to actively engage and stay awake to the way your mind works. And don't go to sleep to it, and don't let it weasel around, yeah, with
I'm
its old
laughing.
habits, right? Really compassionately get in front of it and go, oh, I see you. Okay, let's do this a different way now. And really actively engaging with that compassionate curiosity, with that self-confrontation. Yeah.
Love it. Yeah. Thank
Thank
you.
Called
you.
mastering your own mind.
Love it.
Yeah.
Thank you. Thank you. I loved everything that you shared here today. And I think you so articulately put things available for us to receive. So thank you.
Oh, thank you. Thank you, everybody.
Namaste.